Hello and welcome to the Cycle Tracking Jumpstart Training. I am your host, Brandy Oswald, the founder of Sauvage Wellness. I am a certified fertility awareness instructor and cycle educator. I teach women around the world how to use cycle tracking tools as natural birth control, to have better periods, and to get pregnant naturally when they're ready. In today's training, we'll talk all about what cycle tracking is, how it works and what we track, and how exactly we're using it to prevent pregnancy, to improve our periods, and to get pregnant naturally when and if we're ready. I'm going to share my screen here with you so that you can follow along on my slides. So just give me a moment and we'll jump right in. All right, cycle tracking jumpstart training. Let's do this. In today's class, we will cover what is cycle tracking. We'll explore how we use cycle tracking to get pregnant, how we use it as natural birth control, and how we use it to have better periods. We'll also explore how to track cervical fluid, temperature, and cervix, the three main tracking signs. And then we'll explore opening and closing our fertile windows using cycle tracking tools. Up first, we need to talk about what the heck is cycle tracking. So cycle tracking is the practice of tracking specific body symptoms like cervical fluid, basal body temperature, and cervix changes to know exactly where you are in your menstrual cycle. It's for this reason that cycle tracking is not the same as period tracking. Period tracking is simply noting the day you start your period and counting down 28 or so days later to guess or predict when you will have your period next. But as most of us have experienced, it's not always accurate, right? And that's because we're simply making an educated guess based on our past periods and our past cycles. We're not actually using any real-time information when we're simply period tracking. So with cycle tracking, we are using real-time information from your body to know exactly what's going on inside and where you are at that moment in real time in your cycle. So much more information is provided through cycle tracking. The method of cycle tracking that I teach at Sauvage Wellness and use personally is called the symptothermal double check method. This method is a specialized form of cycle tracking that is one of the many forms of fertility awareness methods. This is a common misconception. There's not just one fertility awareness method. There are several different ones to choose from. And so the one that I use and teach, symptothermal double check method, we're using 4 different rules to make it super effective and accurate. Now, fertility awareness methods are methods of birth control and pregnancy support that are based on observations of real-time fertility signs. With the symptothermal method, you can know which phase of the cycle you are in. You can know if and when you've ovulated. You can spot hormonal imbalance. You can identify your fertile window, and you can optimize libido, energy, and emotional needs throughout the month. So what exactly is the fertile window? This term I've thrown around a few times now. The fertile window is the window of time each cycle that you can get pregnant. And the fertile window is approximately 6 days long for everyone. So it's false news that you can get pregnant every time you have sex. You can't. The fertile window is approximately 6 days long, and is on those 6 days that we are able to engage in intercourse that could result in pregnancy. This is because sperm can live for up to 5 days inside of our bodies in optimal cervical fluid. And the egg, once released during ovulation, can live for up to 24 hours. Therefore, we have 5 days of sperm lifespan plus 24 hours of egg lifespan, and that creates our 6-day window for pregnancy achievement attempts for conception to occur. So you'll see sperm can live inside the body before ovulation happens. So sometimes we're getting pregnant from intercourse that occurred even before we ovulated because sperm can hang out in that optimal cervical fluid. When we're tracking using the symptothermal method, we are keeping track of cervical fluid, basal body temperature, and optionally cervix changes and body symptoms. So how do we use these cycle tracking tools for the things that I mentioned earlier? First up, we'll look at using cycle tracking to achieve pregnancy. We can use cycle tracking to achieve pregnancy because it allows us to open our fertile window using the presence of cervical fluid. Cycle tracking allows us to identify peak fertile cervical fluid days. So the days that our most optimal type of fluid is present for sperm lifespan and mobility. And we can use tracking to keep track of cervical fluid and temperature changes to know when to close our fertile window and we're no longer able to conceive in that cycle. And we also use cycle tracking to isolate pregnancy achievement attempts to within the fertile window. Now, cycle tracking can also be used to identify potential hormonal imbalances that could hinder pregnancy achievement, like estrogen excess, low progesterone, and luteal phase deficiency. How then do we use cycle tracking in the opposite as natural birth control? And it's quite similar. So we can use cervical fluid to open our fertile window and to know that we're in the phase of the cycle where conception can occur. We can use cervical fluid to track, we can use cycle tracking, to track the progression of cervical fluid to know that we're building up into that peak fluid, ovulation's getting closer and closer and closer. And we can use cervical fluid and temperature again to close the fertile window to know that we've passed the fertile phase of the cycle and therefore cannot conceive for the rest of that cycle. And then we use all of this information to avoid unprotected intercourse during that fertile window. And lastly, how do we use cycle tracking to have better periods? Interesting. So cervical fluid can tell us if estrogen is too high or too low, because cervical fluid is made under the presence of estrogen. Temperature can tell us if progesterone is low or if estrogen is high, because temperature shifts in response to progesterone. We can use cycle tracking to spot delayed ovulation, to understand if we're ovulating much later in the cycle than we thought we would, and therefore use that information to better understand when our periods might be arriving and why it's taking our bodies so long to get to ovulation. And we can use cycle tracking to identify the post-ovulatory phase and to see if it's simply too short. In a short post-ovulatory phase, too few days between ovulation and your period can signify an imbalance with progesterone and estrogen, which can really muck up our periods, which we'll look at here next. So this estrogen progesterone imbalance can lead to some really common uncomfortable things like heavy periods, long periods, things like PMS symptoms, breast tenderness, bloating, spotting before the period, and even fertility struggles, including challenges with implantation. So having a really optimal estrogen progesterone imbalance in that luteal phase, that post-ovulatory phase, is crucial for having a healthy, easy, comfortable period, crucial for fertility and pregnancy achievement as well. Let's take a moment to dive into the individual tracking signs to really get a better sense of what we're looking at. So cervical fluid is produced by the cervix under the influence of estrogen, and it is crucial for pregnancy achievement. Cervical fluid is made in preparation for ovulation, and it supports sperm mobility and transportation. Without cervical fluid, sperm could not live very long in our body and therefore makes conception and pregnancy achievement quite challenging. Cervical fluid tells us when to open our fertile window because it's made before we ovulate, in that window of fertility leading up to ovulation. Cervical fluid takes a general transition in our cycle throughout each month. Now, you may not see each and every one of these phases, but we're talking generally what we tend to see in each cycle. The first is our menstrual bleeding, our period, which is not cervical fluid. That's the shedding of our uterine lining. Then we tend to have a day or two of just dryness. From there, we experience wet and watery sensation at the vaginal entrance, and we might even feel like a small gush of water coming out of our vagina and into our underwear. This signifies a transition into a more fertile phase of the cycle. From there, we'll notice creamy or stretchy cervical fluid, and the creamy cervical fluid is almost white and milky like actual milk, or creamy like hand lotion. And the stretchy fluid tends to be a little bit cloudy, and you could pull it between your fingers an inch or so. And this is an increasing level of fertile cervical fluid. Then from there, we move into the peak fluid, or the most fertile type of cervical fluid, which is egg white and slippery. Literally, this fluid looks like you cracked open a raw egg, and the egg white, which is clear and slippery, and you could stretch it quite far, several inches between your finger. And we make this type of fluid the closer we are to ovulation. So we tend to see this type of fluid as our peak fluid just before we ovulate. This is the best type of fluid for sperm mobility and transportation. And then from there, under the presence of progesterone after we ovulate, cervical fluid begins to dry up, maybe even thicken, and become sticky, crumbly, or gummy. Then we can look at the next cycle tracking sign, which is basal body temperature. Basal body temperature is your temperature first thing in the morning before getting out of bed, after at least 3 hours of uninterrupted rest. Now, it's fine if you wake up here and there, it's not going to muck things up all that much, but really making sure to get 3 hours of uninterrupted rest before taking that temp. Temperature tends to be low before ovulation, and it rises slightly after we ovulate, and then will stay high until our period begins. Now, why exactly does this happen? Why does temperature shift? And that's because temperature shifts as a result of the hormone progesterone. As progesterone rises following ovulation, it causes a rise in temperature. We only make progesterone as a result of ovulation, after we ovulate. So we know that if temperature has risen, that's because progesterone is present. And if progesterone is present, we know that's because we've already ovulated. So we can use temperature to confirm ovulation. And then temperature, after it has risen following ovulation, will stay high until our period begins. And it will dip slightly just before the period starts, which is what triggers the release of the uterine lining and a return to those lower pre-ovulatory temperatures. It's important to note that temperature does not tell us the exact moment ovulation has occurred, but rather it informs us that ovulation has occurred after it has happened. It's also important to note that temperature does not tell us anything about impending ovulation. So we're not using temperature to open our fertile window. Rather, we're using it to help us close the window and confirm ovulation. Up next, we have cervix position and texture. Now, the cervix tracking is an optional sign that we use as a confirmation tool to confirm what we're seeing with cervical fluid and temperature. Now, your cervix is located at the back of the vagina, at the back of the vaginal canal, and it feels a bit like an olive. It's rounded and generally firm with a tiny opening on the front. And it's from this tiny opening that cervical fluid, period blood, and babies make their way into the vagina and out into the world. What's the deal with the cervix? So the cervix tends to be high, soft, and open around ovulation under the influence of estrogen. The cervix tends to be low, firm, and closed further away from ovulation that we are, so leading up to our period generally. Now, estrogen softens the cervix and progesterone tends to firm it up. And using this information, we can use cervix tracking as a confirmation tool for what we're seeing with cervical fluid and temperature. And now the cervix can be easily reached with clean fingers. Just as you would insert a tampon, you can insert a finger and tap the back of the canal looking for cervix. So let's take a minute to look at how do we use all of this to really confirm ovulation? Is just tracking enough? And the answer is no, not really. So when we're using the symptothermal double check method, we're applying 4 specific tracking rules. And once you learn these 4 rules, you'll be able to use cervical fluid and temperature to determine the opening and closing of your fertile window, to get that level of accuracy added into your tracking. That's what makes this method the symptothermal double check method. Without the 4 specific rules, it is not the symptothermal double check method. It's just keeping track of your body's symptoms. So, are you interested in learning more? I'm going to take that as a yes, please. So up first, if you're interested in learning more about using cycle tracking as natural birth control, you're going to love my Natural Birth Control Academy course. This is a 12-week group course in which I walk you step by step through everything you need to know in order to use the symptothermal method of cycle tracking as natural birth control, all on your own in just 3 months. It's as good as it sounds. So if you're interested in natural birth control, the Natural Birth Control Academy is the place for you. You will get step-by-step guided through the process, practice charts, one-on-one chart reviews with me, everything you need to know to learn how to use this method as birth control. If you're interested, you can click right here on the slides or head to sauvagewellness.com and check out the Natural Birth Control Academy course. For those of you who are looking for the opposite, you want to get pregnant, you will be interested in Conceive with Confidence. This is a 4-module course for pregnancy achievement. And in this course, I walk you step by step through the opposite, right? How to cycle track to optimize your fertility and to get pregnant easily and naturally when you're ready. So we look at identifying your fertile window without the buffer zone that we use for birth control, really honing in on the most fertile days of your cycle, optimizing fertile cervical fluid, increasing cervical fluid if we need to, and even lengthening out your post-ovulation phase if we need to, so that we are creating the optimal environment for conception and implantation to create pregnancy achievement. So if you're interested in Conceive with Confidence, you can click here on the slide, or again, head to my website under courses to check that out. And then lastly, I have the Sauvage Sisterhood membership community. This is for everyone who's wanting period support, hormonal balance support, and even things like birth control and pregnancy achievement without going through a full program. So in the Sauvage Sisterhood membership community, this is a virtual space for wild women, and you get access to some really incredible tools, one of which is one-on-one chart reviews and coaching with me. Every week I host one-on-one office hours where we can meet one-on-one to really look at your cycle tracking charts, to review how you're applying the rules, what you're seeing, and to help you achieve whichever goals you have, birth control, pregnancy achievement, or better periods. You also get access to my VIP training vault, which is filled with master classes and online trainings on all of these topics: birth control, periods, fertility, pregnancy achievement, even things like reconnecting to our wild woman energy. And you also get access to live monthly workshops and trainings on cycle tracking to continue growing your wisdom and your knowledge to improve your health and fertility. Thank you so much for joining me for this cycle tracking jumpstart training. It has been a pleasure to be here with you. If you'd like to stay in touch, you can follow me on Instagram at Sauvage Wellness, or head to sauvagewellness.com and check out all the many offerings I have for you in this incredible realm of cycle tracking and fertility awareness.